Fascinating. All right, thank you very much on this foray. Well, supporters of the president's health care plan are arguing that the government has a moral responsibility to provide health care for all Americans. But does it? That is the subject of tonight's face-off debate. Joining me now, Reverend Adam Hamilton. He's senior pastor of the United Methodist Church of the Resurrection in Kansas. Reverend Hamilton says the government should be providing affordable health care for everyone. Reverend, great to have you with us.
Well, thank you very much. It's an honor.
And Bishop Harry Jackson, who is the senior pastor of Hope Christian Church in Washington, D.C. He says there should be no government intervention in health care whatsoever. Bishop, good to have you with us. We appreciate it.
Good to be with you.
Reverend Hamilton, let's begin with you, if I may, as we get this debate started. Why do you believe that the federal government has a moral responsibility to provide health care for everyone?
Well, I think it has a moral obligation to make accessible, affordable health care for everyone. And not everyone may take advantage of that, but it has an obligation for that. And I think part of the role of the government is to offer the safety net needed for the most vulnerable of people in the country. And so when I think about the most vulnerable of people, I'm not thinking about people who choose not to work, but people who are the working poor, for whom giving up the equivalent of a house payment to be able to provide health insurance for their families is simply not possible. And I've been with people in my congregation who had to choose between making a mortgage payment or deciding to pay for their health insurance, and they chose the mortgage payment. Or for children of people who are out of work, and certainly right now in this economic crisis, people who've been out of work for some time and their COBRAs run out. And so I think we have to ask the question, what happens with those folks?
I'm really asking the basis for your statement that the federal government has a moral obligation.
Well, I guess the question is, what is what?
No, that's the question. No, that's the question.
Right. And so what constitutes a moral obligation, though? And a moral obligation is, in my mind, related to justice. So we look in the scriptures, and we hear, so from a Christian perspective, we look in the scriptures, we find hundreds of calls for justice. And when we think of justice, it's ensuring the rights of those who can't really speak up for themselves and don't have access. So that's where I'm coming from.
Bishop Jackson, we just heard where Reverend Hamilton is coming from. Your view?
Well, I believe, Lou, that we've got a great healthcare system. A few years ago, I was given 15% chance of living, had cancer of the esophagus, and had I been denied or delayed treatment, Lou, I wouldn't be alive today. So one of the problems of this moral morass that we're in is if you raise the cost of healthcare, and by broadening out all the people that are going to need to get these services, what you may do is say that you're not going to get to certain people, that people have urgent situations aren't going to get treated. We're going to be like this, some of the governments that you overlooked or looked over and talked about. Also, I think that there's...
We overlooked a couple, too, but we'll get back to it.
Forgive me for that. But the reality then is my life worth less because I'm worth more in terms of net worth? Do we have the ability to say, I'm going to get every homeless person health care, even if it means you're going to have other people die? The government is going to have to figure it out. And I believe historically the church has been the people who've decided that they were going to create hospitals, care for the sick, the needy, the poor. And the government is not known to manage things well, Lou. So I'm concerned that if we change this thing, denial means death. And I also want to get, if we get the time, into the issue of paid abortions, which will mean abortions go up by 33%. And in
let's get into that in just a moment. I want to let Reverend Hamilton respond.
Yes. Well, first of all, you've been highlighting countries over the last few episodes where they have health coverage available for more people than we have here in the United States, more folks who currently have no health care here. And that's not raised the price of health insurance. It's actually lowered the price of health care coverage and what's spent per person. I think it's possible for us to maintain our current plan for those of us who are happy with it. I have good health insurance. I'm happy with that. What I'm concerned about, and I know Bishop Jackson has to be concerned with the people in his congregation as well, 15% of the population for whom they don't have that access. What about those folks? And the scriptures call us to speak up for those who can't speak up for themselves. And so I think we have to figure out somehow we've got to solve this problem. However it's solved, it's probably a combination of private and public, but
it doesn't mean endorsing this particular plan. The problem is we're steamrolling a plan that's not been thought out. Its implementation is horrible, and we need to slow our roll, analyze this thing, and do something that's responsible and moral.
Well, let's get to the issue
Bishop,
of. I'm sorry.
I was just going to say, to Bishop Jackson's point, we haven't. I'm not endorsing the current plan either. I'm endorsing the idea behind having accessible health care coverage for everyone.
Well, I think we can all sign up for the idea that it should be something better. From there seems to be absolutely no evidence of any kind empirically to support any kind of proposition in any stage of legislation, either the House or the minds of those in the leadership of the Congress or the White House, as to what that might be. We've got approval and disapproval ratings in the public opinion polls, and we don't even have a plan before us. I mean, this is as Bishop Jackson points out. Let me go to the point that he raised. And Alexander, I'm sorry, Reverend, what is the morality here of federal funding for abortion?
Well, first of all, Alexander was the Secretary of the Treasury, so maybe this whole issue of money is a good point. But when it comes to abortion, first of all, I also, with Bishop Jackson, consider myself pro-life. I would not support public funding going to abortion, but everything I'm hearing from both sides is saying that's not going to be a part of this. So
do you believe? Let me ask you this as a reverend. Do you really believe what you're hearing from either side on this?
You know, there's a lot.
I want a real straightforward answer from a Christian, God-fearing man. Do you really believe what you're hearing from either side?
I think there's folks who are trying to speak the truth in the midst of it, but there's so much heat and so much.
Do you go straight to heaven when you equivocate, or do you find yourself in purgatory or something fancy like that?
Yeah,
Bishop Jackson, you get the next word.
Okay. Well, I believe that we really need to watch the advocates for this program. It's clearly been politicized, and Lou, it's almost like a sophisticated shell game. Folks are saying we want to do the best for the public, but oh, by the way, you don't get to read the details, you don't get to understand the details, and there are many nuances of this moral approach that we don't understand about. And I'll go back to the fact that I would not be here, Lou. I had a 15% chance of living only, had the greatest health care in the world. Why do we want to jeopardize the care from the world's best doctors at a plan that we don't even know what it is?
Well, I'm sorry, go ahead. You get the last word.
I was just going to say, Lou, that's wonderful that Bishop Jackson had health insurance coverage so that he could still be here. But what about the people who don't?
That's the only outcome we want, I'll guarantee you.
Exactly.
I'm sorry, your point?
Well, my point is that we would hope that, what about the 15% of the population who don't have access to affordable health care? They wouldn't be standing here with Bishop Jackson.
What about the issue?
He's here because
if
of
I may, then becomes, what about the number of people who, as Bishop Jackson is saying, who, under rationing, because there is a limitation to the resources, would be denied health care? This becomes a circular argument, I think. I understand your moral position, and I think that each of us is sympathetic to it. The moral quandary, I think, obviously we're going to have to explore that. But we've got a lot of government consideration to do and a lot of governance issues to overcome. Thank you very much. I hope you both will come back as we discuss this issue in the days and weeks ahead.
Thank you.
And Bishop Jackson, we're awfully delighted that the result was, as Reverend Hamilton